Do you know the mental health risks that you actually have within your business? Do you know who your high risk individuals are, or what even they're high risk around? There was a suicide in a company a few months ago, and it actually broke my heart because asking good questions that shows you indicators of how people are actually feeling and how healthy they are mentally with regards to many different factors around support, relationships, leadership, work, communication. And it broke my heart because I was thinking, I wonder if they ran a mental health risk assessment, they would have been able to identify that they had a high risk individual. And you could debate that it may not have made a difference. However, you could debate that it may have done. Asking good questions, not are you stressed, because depending on the day and depending on what's happened will depend on the answer you get. But asking intentional questions around psychosocial risks within your organization will allow you to identify any high risk individuals that you have. And when you identify them as an organization, you can do things to start improving and reducing the risks, not just around them, but around your whole team. But without knowing, you're fighting blind. You've got a high risk of something happening. And it's not just about suicide, it's about cognitive safety as well. They're working around other people. How is that impacting the team? And it's often the quiet ones that wear masks, as I used to, that you don't even know that there's an issue there. But the questions that you ask, the questions that we ask as proactive action in carrying out these mental health risk assessments, can actually identify whether you've got some risks within your business and also how to navigate around those risks to reduce them and to give people the opportunity to get the help and create the pathways that they need. So right now, are you going to be proactive or reactive? Are you going to do something before it happens, or are you going to wait till something happens before you do something? That's up to you. If you've got any questions around psychosocial risks and mental health hazards and risks within your organization and business, feel free to reach out. Always happy to help and ask questions, because I know that this is a bit misunderstood area within health and safety. Always happy to help. So feel free to reach out. Until the next time, take care.